COVID-19. We are still in phase 3 of the outbreak, meaning transmission is still in the form of clusters of cases. As of now, a full 14-day incubation cycle has passed since the last confirmed case was detected. There have been a few suspected cases within the last 14 days. However, they have all tested negative using the same PCR method. Testing of people with flu-like symptoms is ongoing. The next step is to implement a community-based survey in order to detect asymptomatic carriers who would not have been identified unless an active search is carried out. We can safely say that so far we have flattened the curve in Dominica. And this is due to the social distancing measures which have been implemented and practiced, and widespread use of our testing capabilities. We are still leading the way in testing in the Caribbean, having one of the highest testing rates per capita. Now, although the global scientific community is making headway in new treatment protocols and vaccines, this is not an excuse to let down our guard. Immunity to this virus is still questionable, and ongoing research into this virus is inconclusive. COVID-19 still continues to baffle scientists, but what we do know is how to break its chain of transmission. And so I want to encourage everyone to continue the important practice of good hand hygiene, respiratory etiquette, social distancing, and face mask wearing. Remember, we need to stay home unless it is absolutely necessary to leave the house. You should not be going anywhere. Everyone is a potential host for this virus without exception. With this, I thank you.
And let me take this opportunity to apologize to the listening and viewing public for the audio difficulties experienced earlier on. And you would have heard just a little bit ago from the national epidemiologist, Dr. Shaluddin Ahmed, who confirmed that we remain at 16 confirmed cases in Dominica, with 8 fully recovered. 9 of them, fully recovered. And as Dr. Ahmed said, we have successfully flattened the curve in Dominica. However, that does not mean that we have to become complacent. Our next presenter this evening is the Director of Primary Healthcare, Dr. Laura Esprit.
The Honorable Minister for Health, Permanent Secretary in the Ministry for Health, our Deputy Fire Chief, Health Promotion Coordinator, National Epidemiologist, our Moderator, Media, Public, good evening all. It is certainly a pleasure to be here with you once more to provide a deeper awareness as it relates to behavioral change in our national COVID-19 response. Now, in my presentation today, I will differentiate 2 terms that we use a lot since the pandemic started. Despite having only 16 confirmed cases, I will provide you with some details of client number 16 and his asymptomatic presentation, which will indicate that we should not become a complacent populace. And thirdly, I will highlight simple ways in which non-suspected or unaware individuals can transmit the virus to others. Now, the Contact Tracing and Sampling Committee of the Ministry of Health wish to inform, again, as said by our national epidemiologist, as of today, the number of confirmed cases in the Commonwealth of Dominica remains at 16. Of these cases, 9 have recovered, discharged to their private residences, and are presently being monitored by primary healthcare teams in their respective districts. Very importantly, whilst at home, these clients are encouraged to continue to adopt the recommended prevention measures to protect themselves from reinfection whilst maintaining strict home quarantine. The Ministry of Health has adopted guidelines for what is referred to as home quarantine, government quarantine, and isolation as measures to prevent the spread of the virus. In that light, we are aware that for the last couple of weeks since the pronouncement of the pandemic, the public has been bombarded with the words of quarantine and isolation. But what do these terms actually mean? Just to inform you that although the terms are used interchangeably, they are very different. Quarantine refers to restricting the movement of people who are possibly exposed to the virus to see if they become sick. These persons may have been exposed to COVID-19 or exposed to persons who have been tested positive for the virus and do not know it, or they may have the disease and are asymptomatic. So essentially, quarantine is established for all persons who do not have symptoms and are not obviously sick. As such, these clients, in that case the majority, they're expected to do self-monitoring, primarily through their temperature checks and reporting their concerns to healthcare providers should they develop symptoms. Because this is done in the setting of the home, it is therefore called home quarantine. Fortunately, in Dominica, there is a government quarantine facility. It serves the purpose of accommodating asymptomatic clients and ensuring maximum compliance by individuals who are potentially exposed to the virus, or persons who, for one reason or the other, find it difficult to remain quarantined at home. Isolation, on the other hand, separates people who are tested positive for the virus from the public. In our case, these patients are referred to either Portsmouth COVID unit or the isolation unit at the Dominica China Friendship Hospital. Both units have dedicated staff to provide treatment and support for persons diagnosed with the virus. So the main difference lies in the fact that if you are tested positive for the virus, you will be removed from quarantine and admitted at one of the 2 isolation units on the island. Now, our last positive case was confirmed on April 7th, 2020, which is exactly 14 days ago. As a result, some of us have breathed a sigh of relief and have become, unfortunately, complacent. My fellow Dominicans, whilst the frontline and essential workers, as well as you, the public, deserve commendation for your general compliance to this fight, this misconception that we are out of the woods is misleading and can potentially create the environment for the virus to thrive. Permit me to illustrate it this way. We may see a trail of wood ants on the open kitchen counter and have them sprayed. How can we be confident that there is not a nest until we have followed their trail? It's only after finding the nest, treating the area and the adjacent outer surroundings, we can be assured that we have successfully dealt with the invasion. This is what the ministry is aiming to do. Digging deep, tracing, tracking, hunting for the virus, so to speak. However, if the public grows complacent that the lucky number 6 is our peak and subsequently adopts a laissez-faire attitude, then all our gains we have made thus far in the containment of the virus would be lost. On this note, let me take the opportunity to share my concerns with you whilst making reference again to case number 16. This gentleman, young, strong, vibrant, and essential worker, was not sick, yet confirmed as being positive for COVID-19. How is it possible that he did not have complaints of fever, dry cough, and breathlessness? How? Now, this is what in medicine we refer to as an atypical presentation. What made it atypical or outside of the norm? The information received stated that the client was presenting only with loss of taste and smell. Subsequently, upon discussion, he confirmed that this was his usual complaint when he's about to get the flu. Naturally, my follow-up question to him was, so why in this instant you decided to report your concerns? Interestingly, he was encouraged to seek medical attention and was subsequently swabbed, and a positive test result was obtained. Now, was he 60, 50, 40 years old, maybe diagnosed with a chronic disease, and hence at a vulnerable age or at-risk group for the disease? No, he's not in this age group. Neither did he present with chronic conditions. Yet, he was positive for COVID-19 and never felt sick. So, what does this case have to do with the public? A lot. For the most part, from a public health standpoint, this is the most worrisome of cases. But why? Because most times the virus presents with mild symptoms, or it is not entirely unusual for someone, in this case, to have the virus but not have yet presented with showing symptoms, which we call pre-symptomatic transmission. In general, because symptoms are subjective, it means that some people may not report feeling sick, but do have a proven viral infection. The fact that there may be silent transmission, as it were, this makes it difficult to identify carriers of the virus, adding to the fuel of this pandemic. The challenge is that when we are sick, it's easier for someone else to notice that we are unwell. And as a result, we are inclined to seek medical care. However, in the absence of feeling ill, we can be contagious and transmit the disease to others. Hence the importance of physical distancing and adhering to the guidelines of using masks and frequent hand washing to protect ourselves while treating others as potential COVID suspects. This would apply to visits to the supermarkets, the banks, utility companies, bakeries, etc. Furthermore, the rationale that supports the curfew is that if someone is a silent carrier, coupled with a long incubation period, this provides the opportunity for containment, decreasing the spread of the virus. Again, the ministry is not suggesting that the public should be in a state of panic or become overly anxious at all the uncertainties caused by this pandemic. Stress and anxiety in itself can lead to a decrease in the body's immunity, making us more susceptible to all diseases, including viruses. But neither do we want to feel a sense of complacency. For the non-suspecting, unaware individual, the virus can be transmitted in simple ways, and these are some examples. For example, not wearing a mask or some type of facial barrier in public, leaning on the cashier's counter at the supermarket, selecting items for purchase that may have been contaminated by a customer with COVID. For example, if everyone decides to touch the potatoes, apples, onions, garlic at the supermarket that others would have examined before, have we thought of those things? Opening the doors to our vehicles that may have been contaminated. Likewise, leaning on the cars, doorways, railways, etc. Railings, walls, etc. Touching the windows and the seats while maneuvering on the public buses. Walking inside of our homes with the same outdoor shoes. Sharing our cell phones with others to make calls. Forgetting to remove our clothes and embracing our children at home. And what about using the same mask for several days without discarding it? Some can assume that a mask used on Friday may appear not to be dirty and can be reused again after lockdown on Monday morning. However, we are reminded that masks are for single use only. Now, as a God-fearing nation, we are asked in the book of Luke and Psalms to practice what we call love for neighbor and respect for life. Would this command allow us to have a selfish attitude and enjoy, for example, neighborhood wet fetes, quarantine parties, or during the curfew, lock ourselves in shops and bars, giving an impression that the shop is closed while we are inside playing dominoes and having a drink? Question: was our few hours of pleasure more important than our lives? Did we really score points on the police for being defiant? Have we proven them wrong, that despite breaking the curfew, nothing has happened to us? Or did we assume that we are healthy and strong, so we are COVID immune? Sadly, the only thing we would have accomplished is that we would have risked the lives at every occasion to invite COVID into our homes. And this spirit of disobedience would have placed our families, our neighborhood, our villages at risk, all because of one person's ignorance. At any point, did we think that our complacent attitude meant that subsequently a burnt-out nurse, a burnt-out doctor, fire officers, police officers now have to risk their own lives to care for us? Have we thought of those? On another note, to our families and neighbors determined to come home through the unofficial ports, the back doors, we are indeed empathetic that Dominicans, like our students, cruise ship workers, would love to come home, especially during this critical time period. But what happens when we shelter them and do not report to the officials of their presence? In those instances, are we being true to loving our neighbor and respecting life? They too are potential COVID suspects needing medical clearance. A national vigilance will allow each one of us to play a role in having these persons quarantined and inform the officials so that they too can be checked and monitored, bearing in mind one potential case, as we have seen locally, can spread swiftly through a community. I end by saying that despite the protocols and guidelines set, as well as all the provisions made by the Ministry of Health and of course the government by extension, your health remains your primary responsibility. We cannot force you to adhere to them, but on the basis of brotherly love and love for life, we appeal to your conscience to kindly abide to these recommendations. COVID has no boundaries, and as a country, we do not have the privilege of a do-over at the cost of stubbornness or having lives lost. Going forward, we applaud all for your efforts, and we again appeal to you for your continued national vigilance. On that note, I wish to thank all the members of the committee once more, the frontline and essential workers at all levels, bearing in mind that no role is less important. Of course, thanks to our donors, and most importantly, members of the public who not only cheer us on, but adhere to the guidelines. Thank you.
And our profound thanks to Dr. Laura Esprit, the Director of Primary Healthcare, for a very informative presentation with an analogy even to give a clearer understanding of the goal of the ministry, and of course for highlighting the responsibility of each individual to protect us all. Our next presenter this evening has been leading a team who has been on the front line from the jump, and of course their responsibilities are vast. I welcome to the podium this evening the Fire Chief, Josiah Dupuis.
Thank you very much, Ms. Harry. Protocol has been established, and therefore I will get very swiftly into my presentation. At the onset of COVID-19 here in Dominica, the fire and ambulance services was called into action, initially by way of participating in training organized by the Pan American Health Organization and the Ministry of Health, Wealth and New Investment. 6 of our officers took part in this training, and subsequently those 6 officers themselves conducted training with the rest of the body at the various stations on island. We thought it was important that every fire officer received that type of training, and the training was specific to how we manage the calls that we would get eventually, how we would treat with our ambulances in terms of decontamination and sanitization, how we utilize our PPEs in terms of donning and doffing of those PPEs, and disposal of the PPEs once we were finished with them. Subsequent to this internal training which we did, we sought to establish protocols within the organization to address our core function of ambulance response specific to the COVID cases. These protocols had three components. One, which dealt with call management. Normally, we do exercise a certain amount of management, seeking caller's name, nature of illness, address, and so on. But in this case, because of the unique nature of this particular virus, we thought it would be important to add a few more questions. And therefore, the protocols sought to ensure that fire officers on the receiving end of ambulance calls would do the necessary screening so that in terms of our response, it would give us an idea as to what type of call we were responding to, and therefore to take the appropriate precautions. Of course, once the calls or callers gave information that gave us a sense that it may be related to the COVID-19 virus, it precipitated or it caused us to utilize ambulances that we had identified for specific COVID response. Also, the fire officers, in responding to those calls, would of course utilize much more protection than they would normally. Additionally, once we would come from one of those calls, it meant also that we would treat the ambulance differently. So once that ambulance returned to station, we would do decontamination, we would do sanitization, and ensure that the ambulance was taken care of properly before it was returned to service. One of the actions that we took very early also was to identify, and I alluded to that a short while ago, to identify 6 ambulances. Immediately we had 5 of them which became operational for specific COVID response, and probably about 2 weeks later, that is somewhere around the latter part of March, we got the 6th ambulance, and therefore even as we speak now, we have ambulances specifically for COVID response, one at Portsmouth, one at Melville Hall, one at Castlebruce, one at Laplane, Granby. We have one also at Roseau headquarters. In terms of our protocols regarding sanitation, we sought to do a few things additional to what we had in place before. So we implemented more sanitation stations where fire officers could wash their hands, where they could access tissue, bins for disposal of the tissue. We also implemented a system of identifying persons during the day who would do sanitation of doorknobs, of surfaces, using alcohol in excess of 70% as recommended, and these are ongoing. Whenever someone would come to one of our offices, we would ensure that those persons, their hands are sanitized. It's the basic practice that you see, I guess, across the island currently. We also implemented an incident command system. It is a system which is not uncommon with military or paramilitary organizations, and it is meant to ensure that there are specific duties assigned to individuals so that command is actually the beneficiary. The service that we are into delivering to the public becomes much more in focus. And so we identified our senior officers and gave them roles of transportation, operation, communication, food and supplies, and logistics. and with my deputy being the deputy incident commander and the fire chief himself being incident commander. I must say too that very early in March we had a few vehicles assigned to us, which allowed us to do quite a bit of the work that was alluded to a little earlier by Ms. Harry, because the fire service was very much front and center of a lot of the runs that were made, whether it was contact tracing or persons who were suspected of the virus, in terms of transporting them, whether it was from the communities to the St. James facility or to the hospital, the Dominica-China Friendship Hospital in Rolle. I have a collection, I have quite a bit of data in terms of from my transport officer, but I'm going to just give 2 bits of data. In total, we did 56 runs. Those would include transporting doctors from the hospital to their homes and back. It would include taking nurses to the east or wherever it was that we had to do contact tracing. Those would include transporting persons from quarantine centers back to their homes or from their homes to quarantine centers. It would include transporting persons from the from the ports, airports, the seaports, to the quarantine centers. 56 runs in total. And we did transport a total of 356 persons. Those again would be inclusive of the positive, suspect, and persons who may not have been suspect at all, but because of where they were coming from, they had to go into automatic quarantine. I must say that in the heat of all of these activities that the fire service was involved in, we made a plea and got an intake of 28 new entrants into the fire service. And I must at this point really pause and express the gratitude of the entire staff for this intake. We are in the process of doing what we call on-the-job training. And this is not normal times, I suppose, so it is not the normal thing that we would do. We would have a recruit training, but we have adopted a policy of having these new entrants work alongside with fire officers, and at the same time we have a lighter schedule of training which we are doing, and I am very confident in that process. And within due course, shortly, those officers, those new entrants will be able to contribute. In fact, they are already contributing to an extent to our work output at the Fire and Ambulance Services Division. So we are very delighted with this intake of 28 recruits. Going forward, we continue to have meetings projecting, looking at what we have done in the past, and trying to improve on any gaps that we come across. And we, at a meeting, in fact, last Friday with senior officers, came up with a few ideas about what we should do going forward. And one of them is referred to as a buddy system. We have thought of the impact that this virus is having, not just on the wider population, but also on us as a grouping. And so we have sought to implement a system of having one fire officer paired with another. That is to provide direct support. And so every day that fire officer is expected to call the person he's paired with. And hopefully over time, it is someone that he knows reasonably well, and therefore over time he may be able to detect any variation, not that we are saying he becomes an expert, but he would be able to detect maybe specific problems that that officer may be manifesting. And so it is something that we are implementing with the view to track or identify any particular issues that may arise with that particular officer, where he may need intervention, and therefore it is one of the ways of trying to capture that as early as possible. Additionally, we have thought of the idea of engaging persons with a background in social work. And so our senior officers across the island have already made contact with theologians, as an example. And the intention is to get them. They are scheduling dates where those theologians will come to speak to fire officers to lift their spirits. I must quickly make reference to what I saw, especially very early with the fire officers, and there was a certain time that I certainly saw fear. I saw concern. Those are natural attributes in humans, and when individuals have to deal with particular situation that puts their life on the line, their health, that of their family, undoubtedly it does take a toll. And so we think that this is one of the responses of the organization in trying to address some of those issues. More broadly stated, we can speak to this as our continuity plan. But before getting into our continuity plan, and this is where I end, I want to also speak to a few close calls that we have had and how these close calls is informing our policy internally at the fire service. The close calls had to do in one case where the PPE of 2 fire officers got compromised during a call. That was a suspected COVID case. In the end, out of testing, the cases, this particular case was negative. But for a period of time, the 2 fire officers, you can well understand, were extremely concerned. There was another case in point where 2 fire officers transported another patient, and that person died shortly after being transported. And of course, since that case was also a suspected case, in the end negative, but the 2 fire officers had to be isolated, initially at the fire station and eventually at their home. At their home meaning their community. Those officers also really experienced quite an ordeal waiting for the results. So a few persons who are even hearing me tonight got calls from the chief and the deputy, maybe one call too much, but we were concerned, and of course we wanted to be able to bring relief to our fire officers as quickly as possible. And so this has brought into the equation conversations about housing for persons who, one, have either been compromised because of the work that we do and probably the tearing of the PPEs and so on, or just by virtue of the amount of calls that that person may be engaged in associated with the COVID case and their concerns of having to return home. Those are some of the conversations that we are having at the fire service. And it really begs or instructs us that we must pay attention to the welfare of the very persons who are asked to go out on those calls. So we continue to have discussions about it with a few ideas. Some of those ideas have, of course, been submitted for consideration. But as I speak of the continuity plan, as I end my presentation, we recognize that by virtue of the type of work we do, there is a certain risk which is associated with this job, with this work, with the COVID response. And so it is really incumbent on us, the fire officer, to be as cautious as possible. One, by way of ensuring that the ambulances are always in a state of preparedness, meaning that from the last call they were properly sanitized. 2, that when we are responding, that we respond appropriately, wearing the protection that is made available. That we ensure that the cases, and Dr. Esprit referred to it, is probably one of our greatest worries, the asymptomatic case. And so we have been approaching our ambulance response now, as is done in other jurisdictions, I might add, in a manner that we basically, every call we respond to those calls for the most part like it is a COVID case. And so we want to assure the wider public that when you see a fire officer come out to you, even if you just spoke of a headache, and you notice he's wearing a mask, you notice he's wearing glove, do not think that he is suggesting to you that you are infectious, that you're carrying something that you may not be carrying. He is doing it because he needs to protect himself. He's doing it because he needs to protect his fellow co-workers. He's doing it so that he can protect his family, so that he can protect his community and country. We truly believe that if through carelessness or otherwise we find ourselves in a situation where the fire officers become compromised, it doesn't take a whole lot for a station like Rolle, where we have between 35 and 45 fire officers daily, particularly during the week, who could themselves become exposed if we are extremely careless. So we are grateful so far that we have been doing well, we are fine, but we recognize that we are in a very vulnerable situation. And therefore, I appeal to fire officers, first and foremost, that while on duty or even off duty, it is important that we do all the practices that are recommended so that we maintain or reduce the likelihood of our infection, and that in the course of our duty itself, that we again practice all the safety measures that are recommended. As I end, I would like to assure the wider public that the commitment of the fire service is an unwavering commitment, that we are very fortified in what we do, we are happy to serve, and that we recognize that our health is contingent on your health, and that your health is contingent on the health that is projected for the entire country. So I'd like to say, let's join hands with us in the fire service. Let's join hands with Dr. Esprit. Let's join hands with all of the medical professionals, and let us take on this fight, because it is a fight that is worth taking on. It is a fight that we must win. So I just want to end by saying that I would like to express my gratitude for the support from my Deputy Chief Fire Officer, Mr. Later, and for that of my senior officers and every fire officer across the island. Thank you for your fantastic job. Good evening.
And thank you very much to the fire chief and his staff. Let us keep in mind that the fire officers also continue to provide other services. So their work is not just limited right now to COVID-19, but the other situations that they deal with, accidents, bush and structural fires, they also have to respond to that. So let's do our part as a general public to not put them at even a more strained situation where their resources have to be thinned out even more. Let's do our part, drive safely. The bushfires that have been happening recently, we're asking people to limit the burning as much as possible. Find alternatives, composting, or waiting on the solid waste to pick up your trash. But again, the fire service working tirelessly. Thank you very much for your service. And usually we wrap up with a statement from the Honorable Minister, but this evening the privilege is that of the coordinator of the Health Promotion Unit, Mignon, Rolle, Shillingford.
Minister of Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Letitia Lestrade-White, Director of Primary Health Care, Dr. Laura Esprit, National Epidemiologist, Dr. Ahmed, Fire Chief, Josiah Dupuis, and Communication Officer and Moderator, Ms. Sheena Harry. Good evening. Let me first take the opportunity to thank the Dominican public, corporate businesses, our self-employed persons, for implementing and adhering to the necessary instructions given by the Ministry of Health, Wellness and New Health Investment thus far. But please, let's not put down our guard. You heard it before from the other speakers, especially Dr. Esprit, who informed that we have been 14 days and no new cases identified. And Dr. Ahmed, our national epidemiologist, said that we have flattened the curve. However, we want you to continue to follow the preventative and protective measures given by the Ministry of Health. And I will be identifying 10 steps that I would advise you to do. And if we do them, then we will continue to have the curve flatten. Practice proper hand hygiene. Washing hands with soap and clean water. In the absence of soap, use hand sanitizer, but it must be 70% above alcohol. When washing your hands or using a hand sanitizer, ensure that the entire hands is covered. So that means you must cover every area of the hands to consider it washed properly. Proper respiratory etiquette. Cough or sneeze into a tissue. Discard in a closed bin and then wash or sanitize your hands. If no tissue is available, cough into a bent elbow. This way, droplets are not propelled into the air and drop on surfaces, or in the case of coughing into your hands, it does not contaminate the surfaces that you touch. Continuously sanitize frequently used surfaces with approved solutions, that is, bleach 1 in 10, alcohol 70% and above, and Lysol. These include doorknobs, counters, desks, cell phones, office phones, light switches, computers, printers, cubicles, railings, and yes, the bus handles. How long does COVID-19 remain on surfaces? In terms of plastic, 2 to 3 days. Stainless steel, 2 to 3 days. Cardboard, up to a day. Copper, up to 4 hours. So that is why it is always important to continuously clean surfaces. Number 4, so I have mentioned 3 of them. Number 4, boost your immune system. We want you to eat healthy fruits, vegetables for your vitamins, and we also want you to eat fruits that contain vitamin C. We know our citrus, peppers, broccoli, vitamin E, green leafy vegetables, almonds, whole grains, and minerals. In the case of selenium, it helps the immunity because it's a macronutrient. And what are some of the foods that contain selenium? Most of our meats: shrimp, tuna, beef, turkey, chicken, eggs. Okay, so all of these. We want you to consume probiotics, which helps with your gut immunity. It is a good bacteria that keeps your body healthy, and it can be found in some yogurts. Now, in the event that you're unable to take these vitamins and minerals, then we advise supplements. So you ensure that you meet your vitamin intake, your mineral intake, and all of that. We want you to keep well hydrated. And what does hydration do? It moistens the lining of the respiratory tract. It loosens secretions of the upper and lower respiratory tract. And it also prevents the cracks being formed in your nasal passages. So, of course, if you are dehydrated, remember we have spoken several times about the points of entry of the COVID-19 virus and other viruses, which are the eyes, the nose, and the mouth. So when you are dehydrated, there's a likelihood that cracks can be formed in your nasal passage. And what happens? Of course, it increases the risk of you getting these viruses. In terms of water, drink at least 2.1 liters of water or fluids, and that is equivalent to 8 glasses for females. And for males, 2.6 liters or 10 glasses per day. We want you to limit alcohol. And what is the recommended? What is the approved? 1 beer or 1 8-ounce glass of wine for a female, and double that amount for male. We want you to avoid coffee and caffeinated drinks because they can make you more dehydrated. Also, we would like you to have at least 2 days free of alcohol. So if you go with the rate that you would take in terms of 1 beer for a female and 2 beers for men, within the 7-day week period, we would like you to have 2 days alcohol-free. We want you to ensure ample rest and also exercise. Regular exercise plays a starring role in keeping you healthy and preventing illness. It will help in keeping the quarantine pounds down. Yes, I know a lot of persons have been complaining that they have already put on weight since this quarantine period. We want you to wear masks when out. Place, wear, and remove them properly. And ensure hands are washed and sanitized before placing them, which means I protect you and you protect me. Mask should not be worn under the chin, nor should it be worn on the forehead or hanging to the side of the face. Practice physical distancing, at least 6 feet, which is 1.8 meters from all individuals. Stay at home if you do not need to go out. Limit frequent visits to the grocery stores. Make a list to assist you. Develop a family plan to keep COVID-19 out of your homes and stick to it at all times. Ensure all occupants of your home are aware of this plan. One of the things entailed in the plan could be having a clothes bin downstairs or immediately as you enter your house. Then, remove shoes and leave it outside, and remove at least the first layer of clothing when you enter the house. Place it in the clothes bin or in a plastic bag and tie. Proceed to the bathroom and wash your hands with soap and water. You can now remove the second layer of your clothing and take a warm shower. Plans should also include limitation of visitors to your home. Now, if visiting is necessary, all visitors should be directed to the bathroom to wash their hands. The plan should also identify which bathroom, if you have many, should be used for visitors. No hand towels, only paper towels should be used. Also, identify where the visitor sits and where family members sit. This chair should be sanitized after visitor leaves. Another thing included on the plan could be making a list of supplies needed and identifying the individual in the house who would go out to purchase the list of items. Ensure that all bags, receptacles are sanitized when coming into the house. So for instance, you wash tin cans, you rinse the bag, and so on. Identify a room or space that can be used as a quarantine area in the event that someone at home has a flu-like symptoms. Of course, we speak of this COVID-19 virus as a disaster. It is a health disaster. Do a disaster box and ensure that your disaster box has a first aid kit. It should include medications for persons who are with chronic diseases, so like our asthmatics or persons with diabetes, high blood pressure, and they should have an extra month supply. It should also have things like paracetamol and cough syrups and so on. Keep your house well ventilated and allow the sun to enter. A scheduled time to talk about the situation, especially with children and the elderly, is also important and should be included on the plan, apart from other things. And the final step, if you are experiencing a flu-like symptom, fever, cough, sore throat, malaise, shortness of breath, please call the COVID hotline. And the numbers are 448-2151, 448-2153, 448-2156, toll-free number 1-800-219, and 611-4325. If we do all of this, I surely believe that this curve will stay flattened. And remember, as we always say, at the health promotion unit, your health is your responsibility. Let me take the opportunity to say thank you to the health promotion team, unit team, and also our newest members, our COVID hotline. Blessed night all.
And thank you very much to the coordinator of the Health Promotion Unit, Mignon Rolle Shillingford. And that, I believe, was a very apt way to end this evening's briefing with a reminder of what needs to be done and why they need to be done. Of course, if we want to continue on this trajectory and not have any new cases reported. So with that, I'd like to thank all of our presenters this evening and all of you for joining us. Good evening.